Now that Bill is kind of all warmed up, I take over and try to rip his leg off a little bit. We work on some good passive stretching, trying to restore, once again, some better hip flexion and get the hamstrings lengthened. So I take him up, well past the point that he's comfortable with. I'm not torturing him too much. You feel a good stretch there, Bill?
Oh, yes, very much.
And I try to get him to, stabilize so that he's not going into too much of a posterior pelvic tilt. Just keep your stomach a little pulled in there, Bill. Think about drawing your abdominals in. And he's getting a good stretch back there. And, I would keep it there for a good 15 to 20 seconds or so. So, once again, you only had about that much hip flexion when you started with Lane. Now we're able to get it, measurably higher. And at that point, we feel a pretty good firm end feel. His pelvis rocks a little bit into a posterior pelvic tilt, so anything past this right now isn't really hip mobility, it's more his pelvis tilting, so we'll stop there. We'll do this a few times, and I'll kind of repeat the same procedure on his left leg as well. Bill, try to bring your knee up to your chest. You're going to help me. And then push away. I do a little bit of manual resistance as well. Knee up to your chest. Try to take advantage of some of that passive mobility that we just gained. Push out. Push out. Push, 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 push. Good. Bring that knee up again. Good. Push. Push, 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 push. Bring that knee up. Again, push right in my hips. And I'm just kind of resisting it, getting him to lump a little bit more. Now he can relax. So a little bit of a contract, relax type approach to trying to gain. And then we get even a little bit more mobility out of it now. I know you feel that, right? Working a lot on trying to gain a little bit more abduction. That's about where he was capable of getting when he started with me, only about maybe 5 or 10 degrees. Now I can get him out a little bit past that. I probably feel that a little bit more in the groin area, Bill.
Really, that's where it is.
Yeah. Getting this hip to move better is really an integral part of his rehabilitation. As you'll see later, he struggles a little bit with sit to stand, getting off of the table and chair, a lot because of how restricted his hip flexibility is. He can't really get through those hips too well. So, and that also affects a little bit his gait and him having a good stride length as he walks, in addition to some of the normal issues affected by the Parkinson's as well. So we're really trying to get this hip moving a little bit. And Bill, just slide a little bit over here towards me. And another motion that we work on is his tight anterior hip structure, the iliopsoas, and a little bit of his quadricep. We bring the hip down into extension. And bend his opposite knee. You can bend that one, Bill. Keep your stomach a little pulled in for me. And probably feel that right in that front part of your thigh.
Right across the top,
Right
yes.
across the top. Then if I do a few on this leg, we'll kind of repeat the same procedure on his other leg, and then we'll also do some stretching to his heel cords, which are tight. So it allows him to get a little bit better of a heel strike when he walks too. So more to come on that later. You can show that.